Well, good afternoon and welcome to the Small Business Briefing. It is Thursday, May 6th. I'm Rob Fowler, the CEO of the Small Business Association of Michigan. Brian Calley is our president. Brian, I don't know why, but the camera is on you, so don't do anything goofy right now because it's going to show. Let me start out, as we often do, thanking our sponsor. Our sponsor is Health Screen and Healthy Visitor. This is a tool to help you stay compliant for daily health screenings. We've used it. It is simple, it is painless, and it helps you stay compliant. You can find out more at healthycomply.com. Brian, today is the effective day of a new epidemic order. It was announced last week by the governor and the Department of Health and Human Services. Generally speaking, what does this tell us, I guess, as we see, progress towards reopening?
Well, it's a reaction certainly to the decline in case count that we see happening, and also to changes that are happening around the country and changes that are recommended by the CDC. So this one, we'll get into it, and we've got a guest, and as soon as we're done there, we'll get into it a little bit more. But basically, it's outdoor. It's tied to outdoor activities and some changes in mask requirements and guidelines. So I think the thing that really drove this epidemic emergency order was the upcoming graduations and weddings and a lot of things that could happen outdoors. The guidance on outdoor in terms of wearing masks and the safety of it has it's come along, and it is time to make these changes. So definitely welcome changes, although we still got a lot of work to do on the reopening front.
Well, we'll dig into that just a little bit here in a minute. But as you mentioned, we have a guest today, and actually, I'm delighted to have her. Laketa Henderson is the new Michigan District Director for the Small Business Administration. Laketa, welcome. When we were introduced by your predecessor, she referred to us as the other SBA. I think that's partly because we are so often confused.
We are.
And, that's okay with me. We settle it, we try to sort it out. But I thought maybe it'd be good if we just started with maybe introducing you and let you talk a little about the role of the state director for the SBA.
Okay, well, thank you so much for inviting me. It's a pleasure. And if we're getting confused, it's as long as we're good company, that's okay with me. Again, I'm Laketa Henderson. I am the district director of the Small Business Administration's Michigan District Office. My role in this office is to manage our services and our programs, which is our loan products, our federal contracting, and our counseling and training. And I oversee and work with also our resource partners around the state who offer our services, because of course we have such a small staff in the district office. So we have resource partners who do a lot of the coaching, training, and mentoring, such as small business development centers, women's business centers, SCORE, and VBOC, Veterans Business Outreach Centers, and all the other entities that support us in our endeavors to reach the small business community to ensure that they have access to capital, resources, and are able to start, grow, and expand their business.
Well, it's been interesting. You have certainly been in the spotlight. The SBA has certainly been in the spotlight during the course of this pandemic. And, it was interesting. There were times when I think small businesses were frustrated with, process. And I know you were too. I often made it a point to say that there's a difference between the state office and the federal office. And that is where some of the hang up was. In fairness, the SBA was asked to do some things they had never done before in the existence of the administration. Let's talk about one of those. It's PPP. Maybe, actually there's a little bit news to be made or to be told today. Talk a little about the PPP and, the resource that it's been. You're muted, Laketa.
Okay, sorry about that. The Payment Protection Program, yes, we do have some news, but it has been an invaluable resource in terms of the first draw as well as the second draw. And you're correct when you say we started off a little rough. But we like to say we're the engine that could. We've been given this monumental task, and as many people may not be aware, the SBA has written more loans now in the last year than it is written in 10 years. So we're one of the smallest agencies. So I'm still proud of the fact that yes, there have been hiccups, there have been process issues, but we've still been able to overcome and get the monies, the desperate monies that have been needed to small businesses. In regards to the Payment Protection Program, it has been absolutely phenomenal in terms of the monies we've been able to get out to small businesses. As of today, and I wanted to share, I'm trying to pull up some notes, but as of today, after serving more than 8 million small businesses, general funding for the Bipartisan Paycheck Protection Program has been indeed exhausted. The SBA will continue funding the underserved, the outstanding approved PPP applications, but new qualifying applicants will only be funded through a $9.9 million set aside to community financial institutions. So if you have not yet begun your process or just beginning, you will need to reach out to a community financial institution or CDFI lenders to help you get access to those monies. And you can reach out to my office and we have a listing of those and we'll try and move you to those lenders. The SBA is committed to delivering economic aid through the many COVID relief programs it's currently administering and beyond. So right now, I can't say if more monies will be added, but right now we still have that pot of 9.9 billion. So reach out to the local district office, give us a call, and we will, or email us at mdo@sba.gov, and we will definitely reach back out to you to see if we can connect you with a community financial lender.
And I think actually we have on our website that list of CDFIs as well, because we've been trying to promote that set aside program, and particularly to those companies who are in areas that have traditionally been underserved or are a minority owned company or veteran owned company. So good, but the news is the PPP, as we know it, is coming to an end, unless it's refunded, in which case we'll stay on top of that and report it as we go along. Let's talk about the other big one, which is the Restaurant Revitalization Fund. It's sort of just beginning. So what can you tell us about that one?
Actually, we launched it on Monday. It launched at 12 o'clock. And as of yesterday, we had 186,200 applications, through various restaurants, bars, and other eligible entities that can apply. And what's the good news? The real good news about that is over 50% of those were women owned, and 61,000 of those applications are for businesses that had pre-pandemic revenues of $500,000 or less. And what does this mean? This means that this is truly reaching those that it was intended to reach and designed for. It was designed to reach those small restaurants and bars who've been struggling during this pandemic. And this was created. The Restaurant Revitalization Fund was created to try to help them meet their needs to get them back to their pre-pandemic revenues.
One of the things that was clear to us, the list of eligible entities, everybody thinks about restaurants, but this is food trucks and caterers and some other businesses that have really been struggling during this period.
I'll just give you a quick, because I made sure I had that: restaurants, food stands, food carts, caterers, saloons, lounges, taverns, snack and non-alcoholic beverage bars, coffee shops, bakeries, brew pubs. I mean, the list goes on. Yeah. So go ahead.
Well, I know we could keep talking about these things, and we may have you back as news breaks. I want to just say congratulations. I have known a couple of your predecessors in this position. delighted. You've always been a great partner for us as you know, Michigan Celebrates Small Business, to name one. Let's end with this. Normally, this week would be National Small Business Week. Normally, you and I, or you know, in the case of your predecessors, we would be talking about the sort of the state of small business and what's going on and celebrating small business this week. This is not Small Business Week. What can you tell us about that?
I can actually tell you that National Small Business Week is going to be September 13th through 15th this year. We announced it last week, and I think a press release was supposed to go out, but we're going to hold it in September. We're not going to be doing state awards this year, but there's supposed to be more information to come. I'm looking forward to it. It's been last year and this year have been so different. I'm just hoping that next year will be a better difference for all of us.
Well, from your lips to God's ears, thank you so much for joining us, Laketa. I look forward to working with you.
Thank you for inviting me.
All right.
It's a pleasure.
Brian, we said we wanted to come back to this new epidemic order. So let's spend a minute on that one. It does have some impact on small businesses. What do you think?
Yeah, so a couple of things I thought that we could maybe highlight here. First is that there's a difference in mask requirements. So the big one is that outdoor events up to 100 people don't require masks, but it has created a few inconsistencies with the MDHHS rules. So just as an example, if you're to have a gathering with 100 people somewhere, then masks, you'd say, okay, if it's outdoors, masks aren't required. But if it was outdoors at a restaurant, then, well, when you're going back and forth to your table, under the MDHHS rules, it still would be required. So this has created some inconsistencies between rule sets now, and so that's something we got to get to the bottom of. As we identify those types of areas where there are conflicts, we're trying to raise them to the attention of the folks that are making the rules. In this case, I think it provides a really good argument for why Michigan's OSHA should not move forward with making their emergency rule set permanent. And they've got a hearing coming up. Stay tuned on that, because if they go through with that hearing, we're going to want a lot of advocacy to get those backed off. So the other is that large outdoor events up to 1,000 people will start being allowed again. So there are like festivals and things that happen throughout the spring and summer and fall in Michigan. And the rules changed in a way that I think really gives the green light for a lot of communities to let festivals like that happen. But here's the thing: they put a number on it, like a cap of 1,000. There's no way really to manage a lot of these festivals in determining how many people are there at any given time. So I think that everybody understands that's not particularly realistic in most settings, and therefore when communities move forward, maybe there's going to be 1,500 people at a gathering, or maybe it's going to be 500 people. I mean, to me, this is just an acknowledgement that these larger scale community events outdoors are going to happen this year. And there's a requirement that they have their public health plan posted. And then the other big changes for stadiums, outdoor stadiums that have increased capacity limits that are allowed for them, and so that is 20% of their fixed seating capacity. So you'll see a lot bigger amounts that are available, or a lot bigger seating requirements, capacity allowances in places like Tiger Stadium, for example, or University of Michigan's football stadium, the Big House. So like those types of venues will be allowed or green lighted for a lot more people, but it's still going to be 20% of their fixed seating capacity. And I wouldn't be surprised if those didn't change again sometime pretty soon, especially as we see what's happening around the world with respect to capacity limitations.
Yeah. All right. This is not Data Monday, but we are really going to have to obsess about vaccinations, and because of the new kind of framework we're in. On Monday, I had a chance to do the Data Monday trip. We talked a little bit about what was going on in vaccinations and some concern. You have some updated data on vaccinations and what's happening kind of trajectory wise.
I have updates. The updates are not good.
Yeah.
So as we take a look at this week's numbers, we see that this blue line, which for our reopening is the most important line, this blue one right here, it has continued to fall and fall dramatically. So the average about 18,000 new vaccinations or first doses per day. That average just at the beginning of April was 57,000. So that is a dramatic decline. Last time we talked about this, which was a week ago today. So last Thursday, last time I was on here and we talked about this, I said the big question is, it had fallen all the way down to here. Is that where it's going to level off? And it looked like maybe it was going to level off and it'd stay at that level of 30 to 35,000. It didn't just level off, it continued to fall. Very, very concerning. It's something that I think really is going to shift our advocacy efforts toward back toward the case counts in terms of reopening. They're coming down. They're coming down rapidly. We see reopening happening all over the country. Here's a look just at weekly first doses, and you'll see that it's a 68% drop over the course of this month. So that, or over the course of the previous month in April. So this is just a massive drop. I knew it was going down. It was obvious it was going down. The extent to which it has dropped off is kind of surprising. Now, the Michigan Economic Recovery Council did an estimate based on different possible trajectories, how long it would take to get to 55 and 60%. And this low one here, which if I look at the last couple of days, on Monday's report, the total vaccinations in our state went up 0.4%. Tuesday, it was 0.2. Wednesday, it was 0.3. So as you can see, that it's going to take a long time to get up to even 55 and 60%, let alone 65 and 70. So if we had stayed on the original trajectory, we'd have hit 70% by mid-May or late May. And that's obviously not going to happen now. So the question is, how long does it even take to hit 55 or 60%? So pretty concerned about that. And then here's where things stand in terms of the top 20 and the bottom 20 states. Michigan doesn't appear on either of those lists because it's right in the middle. It's 28th with 50, well, in this case, 54.2%. This is using the CDC data. And again, another piece of our advocacy, our state is using the state data, which is incomplete. The state data does not include all of the vaccinations that are given to Michigan residents, because some were given in Florida and some were given in Ohio and some were given on military bases and some were given at VAs. That is not included in the Michigan numbers, and it needs to be, it should be. So in looking at this CDC data, which is where we have to go to get all of these other states, we see Michigan is right in the middle, 28th. There are some states that are over 70%. So a couple of them, New Hampshire and Massachusetts. Others that look like they're well on their way to hitting 70%. Michigan is, according to state data, is at 51%, but we need to use the CDC data on this because it is more complete than state data, and it shows us nearly at that 55% threshold. So it's not exactly clear to me why we are not using the CDC data, and so my hope is to get to a point where we are back on the CDC data very soon. So I'm oh, here we go. Just need to pull that off. So I'm concerned. I mean, before, just a month ago, the trajectory was totally different. We always knew it was going to slow down. It slowed down way more than we were expecting.
And I don't know whether this complicates this or simplifies it, but there's a lot of talk about under 16-year-old population. Pfizer expected to be approved for 12 to 15-year-olds in the coming weeks. Some potential other, will that be counted in this population? How do you think that will play out?
I talked to the governor's office about that when it became clear that the FDA is on the cusp of approving Pfizer vaccine to be used on 12 to 15-year-olds. So what does that mean for hitting these goals? That will be just, for at least for the time being, that will just be completely separate. So we won't have to get 70% of 12 to 15-year-olds, but also the ones that do won't be counted toward the total for this reopening goal. So, you know, I don't know exactly what the right answer is on that. I think that getting to a point where, number one, we use the CDC data, and I think we've already chosen the denominator about 8. The governor wants 70% of the 8 million people that currently qualify for the vaccine.
Yeah.
So the way I see it is take those 12 to 15-year-olds, any of them that get the vaccine, add them to the total that got vaccinated, but don't increase that denominator of the fraction, that 8 million. And so that's what we're hoping for. That is not the direction they're going yet, but well, you know us, we don't give up. So we're just going to keep on working on it.
You know, I think one of the things that's become clear is that you know, Michigan has taken a little different path than some other states, and you know, we've tried to pay attention to what's going on in other states and other countries. Tell us what you're seeing as you look around the country and maybe even around the world.
Rapid reopening is what we see happening, lifting of capacity limits and lifting of other restrictions. So my first example won't surprise anybody. Governor DeSantis in Florida has suspended all restrictions put in place by counties and cities. So the state had already lifted restrictions, but counties and cities could have their own. Now counties and cities can't have their own. So now the capacity restrictions are lifted across the entire state. So some people say, okay, big deal, but that's a, you know, Republican controlled state. What's happening with states like Michigan that have a Democrat that is in the executive office governor? Well, New Jersey, New York are both, and then Connecticut in addition to that, including the East Coast states. But New York and New Jersey in particular will allow restaurants, theaters, and all other businesses to fully reopen. So it's they still have safety protocols, masks and things inside. They're not lifting all of their protocols, but they are lifting the capacity limits on these businesses. We also see over in England, Prime Minister Boris Johnson just announced that due to the success of their vaccine rollout and what that has done to their overall numbers and the case counts and hospitalization and fatalities all dropping to extremely low levels, that they're allowing everybody to reopen, including what was previously considered the highest risk type businesses, like dance clubs and things. So they've done some experiments. I think you covered that when I was out earlier this week, and that's the second that they've done, and they feel pretty good about the outcomes and the results, that they're comfortable moving forward. So I think that as of the middle or toward the end of June, you'll see in England, one of the hardest hit countries in the world, is going to eliminate all of their capacity restrictions.
And you know, it's if you're not completely affected by it or directly affected by it, it's hard to imagine how these capacity limits are affecting, really strangling the businesses who are under them today. And so our advocacy really is about, we've got to get beyond capacity limits. And so let's stay kind of focused on Michigan. We've touched on this from time to time. The Unemployment Trust Fund started this pandemic, or prior to the pandemic, was at $4.6 billion. It was one of the best funded UI trust funds in the country. It has taken quite a hit. Where do we stand today, and what are the implications of that?
So over 3.3 million Michiganders have used the unemployment system during the last year. That's an unprecedented amount. There's never been anything anywhere close to that type of utilization. A lot of it was federal pass-through dollars. Those 3.3 million collected 33.5 billion in state and federal resources. Now the state portion trust fund, this is the one that we watch this portion closely because that's the part that our state employers have to fund through your unemployment insurance premiums. And that has gone from 4.6 billion down to 600 million. And I kind of thought it was going to go into the negative. Things turned around just enough, just soon enough to where it didn't actually go negative. A lot of states did, but ours started out strong enough to where it never went negative in the first place. But it's very low, and it will result in higher premium assessments to employers moving forward. And this is why you will hear a lot from us going forward about the importance of having the work search requirement added back to unemployment decisions. So in the history of unemployment, there's always been a requirement that when you're on unemployment, you have to be available for and searching for work. During the pandemic, they removed the work search requirement. That was under emergency order that is now expired. And yet, even though technically the work search requirement it applies, there is no mechanism to check, report. There is no accountability for it. Most people on unemployment wouldn't even know that the work search requirement has been added back. So this is going to be a top priority that we need to turn that around. There's a lot of demand for people out there, and there's also a lot of need to turn around the balance decline in the unemployment insurance trust fund as well, and that means we need more people back to work.
Well, like you, I thought we would go into the negative in the Michigan Unemployment Trust Fund, and it is a little bit surprising to me given the pace we were on that we didn't. So interesting. Let's kind of, we only got a few minutes left. Let's talk about some things happening at the national level. The DC District Court yesterday, I think, interesting ruling on the issue of evictions and whether or not there's been a moratorium on evictions. Actually, the Trump administration first, and then continued by the Biden administration. We've done a version of it in Michigan as well. What was that ruling? What are the implications of that?
So the DC District, the federal court, took up a case and decided in favor of the landlords that this eviction moratorium does not stand or cannot stand. Now it will and is being appealed. There have been other cases, and it's been all over the map. We've got other local courts at the state and the federal level who have taken up this issue and said, yeah, the moratorium is fine and legal, and others that say no, it's the eviction moratorium is outside the authority of the executive officials that implemented it and issued it. So at this point, I think it's highly likely that it will be taken up by a court of appeals. I think it's also that if it's not settled there or if it doesn't go away after, in terms of if it's not rescinded, it'll just keep on going all the way up to the Supreme Court. I think that it's legally shaky ground. So these are contracts, and contracts are for rent and for mortgages. These are contracts are protected by state and federal constitutions. And so I think it was always shaky ground to put an eviction on moratoriums, or a moratorium on evictions. So I think this is one where it might be kind of the first step toward a really big issue is how does all the back rent and mortgage payments get made up at a time when the federal government said, hey, nobody has to pay their rent and mortgage payments.
Fascinating issue, and I think small businesses find themselves on both sides, both landlord and tenant, in many cases. So we'll keep an eye on this one. Also, just recently, a executive order from the president on minimum wage for federal contractors. The issue about minimum wage, national minimum wage for everybody, all employers, has been debated by the Congress, but the president can do this just for those who are sort of in his in his authority. What do you think this means?
Yeah, so this is going to affect anybody who has a federal contract, and it's going to follow all the way through to where if there's somebody who has a federal contract and they subcontract some of the work to another business, and that's where I think this is really going to have the biggest impact, is on those subcontractors on federal contracts have to meet the minimum wage as well. So the problem is always with minimum wage is at a federal level has always been that what makes sense in one area does not make sense in another area. So if somebody handles a federal contract for something at a park in the Upper Peninsula, the minimum wage required there is the same as somebody handling a federal contract in New York City. Yep. And it doesn't make sense. Some estimates are that it could affect up to hundreds of thousands of employees, and so I think naturally it will result in higher costs to the federal government. But it's just anytime something changes with the government saying here's a new minimum wage, we pay close attention to that, because we know that it's small businesses in particular are the ones that get hit the hardest. And then the employees are the ones that, according to the Congressional Budget Office, every time this comes up, that there are a lot of employees that lose their jobs over it.
And I would say, a national minimum wage, small businesses in the Midwestern states in particular are hit hard by this one. So something we'll continue to pay attention to. Well, that's all the time we have today. Thanks for joining us. Let me just mention one webinar that's coming up next week. It's on the issue of trade secrets and how to understand your trade secrets and properly secure them. That is on Wednesday, May 12th, 2 to 3 o'clock. Hope you can join us for that. Thanks for joining us today. We'll be back Monday at 3 o'clock. We'll be doing Data Monday. In the meantime, remember to wash your hands and
don't touch your face. See you next time.